President and CEO of Mississippi Hospital Association. Good morning, Tim.
Good morning, Paul.
Whoa. I'm sorry. There's a flash of yellow there. That
I need to tone it down this morning.
Well, you ought to check out the shirt.
Hey,
I see it.
all looks good. Yeah.
Hang on just a moment. Gladys. She's just trying to get Gladys Knight in here before. Good to see you, my man. I appreciate it very, very much.
Good to see you.
You are looking good. Let's tackle this first of all, because it was. And I'm not sure, not being involved in that arena, what this means for the people of our hometowns across the Gulf Coast, all of the SuperTalk hometowns and elsewhere. So your overview of this announcement that the board decided to let go of this and put it on the market.
Yeah. And that's unique in itself. Typically, the decision comes from the owners, which is usually the board of supervisors, or the city fathers or whatever. I think what you're seeing here is a joint effort of both the management, the board, and the board of supervisors in trying to be sure that they ensure high quality care. Health care across the coast as they have in the past for many, many years to come. Paul, the challenges that our hospitals are facing now, as we've talked about numerous times, is continuing to get worse and worse. And our public hospitals are certainly feeling the brunt of that. So I think, I think everybody wants to keep health care at home, but they also have to be sure from a fiduciary responsibility and a responsibility to just the general public to maintain health care as needed. And look, it's not surprising. I know there's talks of Osher's health care system, and they've been working with them for a long time. Great health care system out of Louisiana. But, it's not surprising that a state that has expanded Medicaid is able to have a health system to come over to Mississippi and bail us out.
Ooh. You didn't wait long to get that in here.
Well, it's just important. I mean, we need to understand that.
But if that's the case, why would they do that then? Why would auctioneers even look at it since we haven't expanded Medicaid?
Well, they have got a very strong system. There are certainly economies of scale. They have been working with Singing River for a number of years now in different capacities, and that has increased over time. They do a great job. But
that's political speaking. If it's based on the reason they're closing down or they want to get rid of this is because they financially cannot, they're not making any money. But then again, even if they're breaking even, why would a municipality or a local government or any government own a health care in this market today? Is that's kind of a trend where the old county hospitals or city hospitals, the taxpayers don't want to support them anymore, give them to the private market.
Well, and you have to look, too, the taxpayers on the coast have not supported Singing River Hospital, the health system. That's never been the case. Tax dollars have not gone. They certainly have a liability there that if something were to go wrong, that would come back to the county. But they've never financially supported those hospitals to start with. So that's really kind of a misnomer that a lot of people think.
Are they financially sound?
They are. They're,
as far as you know,
they have come a long way over the last couple of years. They've done a lot of things. They've expanded, as you know, over into the Gulfport area. And I think what you see is a situation where, okay, guys, things are going pretty good. Maybe it's time that we look at long term. Is it going to stay this way, or do we need to be looking at a strategic partner that can bring additional capital into this market that we won't be able to?
So the people who handle the administration of the hospital, that complex, and by the way, how many hospitals are we talking about in this deal?
That would be 3 in the Singing River system.
That's the Gulf Coast. Where else?
That's just those 3 are on the Gulf Coast.
On the Gulf Coast.
That would be Singing River, Ocean Springs, and Garden Park.
So what we're saying is the administrator or administrators have done such a good job of at least on the books in running that thing that it's a valuable property and now's the time to sell it.
I think you could probably say that.
Yeah,
and I think it's looking, of course, it's a long-term look too, Paul. It's not. They're not in a situation they're having to do a knee-jerk reaction. It's not something that they have to do. And of course, as you and I both know, it's well codified as to what has to happen over the next few weeks and months, actually. So I think certainly with the hospital and the board being on as you say, on board with this decision, it's less likely that there would be some type of referendum. But if there were, that would
I was just wondering if Ochsner's did not, would there be other suitors out there behind them?
I don't really have a way to know that. I would be shocked if there were not.
I was going to say, because that's I have no idea what the price tag on that would be.
Yeah, I wouldn't either, and they would have to be a pretty extensive evaluation done.
Yeah. It was interesting the other day when we had the announcement that our friend Woodwell, as well as the former governor of the state, Ronnie Musgrove, were combining to get into the marijuana business. And one of those are, I guess, a member of your hospital association.
Yeah, actually they are. I was kind of shocked to see that too. It's going to be an interesting twist. They are certainly on the testing side of it, so I think that's probably appropriate for that venture.
And that's all you're going to say about that?
Yeah, that's all I'm going to say about that.
Paul,
maybe that's something we should look at. Maybe we should.
As a customer or as an investor?
Look, the way healthcare is going, it may be both.
Well, I mean, we are both charged in one way or the other as dishing out fertilizer, and I've got some farm experience. So,
and I've got the farm.
So there you go. So all we need is just some 2x4s, and we got it made. I do want to talk about this, though, as far as the legislative session coming up. The push is going to be once again on trying to expand Medicaid.
Sure.
And also the postpartum deal didn't go down last time. Do you think that's going to rise again in 2023?
Oh, I think it will. I think we'll see a lot of things come up. And as we continue to see the strain on our public hospitals, it's going to become more important to do that. And I don't know if you saw yesterday, North Carolina Senate actually passed overwhelmingly Medicaid expansion in North Carolina. That was one of the 12 states left. Now, it's got to go to the House, and, of course, we know that may change the whole outcome of this thing, but at least you're seeing a huge shift in the thought process of Republicans across the country.
What do you think you guys have got to do? You, as the CEO and the president of the hospital associations, and some of the folks, just to bring to the table the governor, the speaker, the lieutenant governor, and reach some kind of conclusion on this where at least it has a chance. What do you have to do?
Well, I think we need to get into some serious conversation first. We can't even seem to get that going. We certainly have some really good conversations with Lieutenant Governor, and I think is open and has on numerous occasions said he was open to having discussions about different options on expansion. We've not had that much luck with. We have had conversations with the speaker, and of course, ideology is just different there, and we've got to figure out a way to get through that. Have not had an opportunity to sit down and talk to the governor about it, and would love to do that. Would love to sit down and understand why.
Having the limited conversations that you've had with the speaker and the lieutenant governor, specifically with the speaker. Was there any give and take at all, or was it just a shut door on this one? In other words, if would you agree to change some numbers or do some things if he would do this and that? I'll ask you that question, and we'll get to a couple of other things. With the one and only Tim Moore, President and CEO of Mississippi Hospital this morning. Tim Moore, President and CEO of Mississippi Hospital Association. There we are. Let me say this first of all. You are right that the Medicaid expansion, we're kind of dwindling down to fewer states that have done that. And it is one of those things that collectively we get a lot of negative publicity because the liberals, the left, love to tackle us like this is just a stupid, primitive thing not to do. and I think a lot of people are confused about it, but it's one of those negative things that we just get beat over the head with, and I think unjustly for, because there are a lot of people in the state who says it's not a good idea. But that being that, I remember a good friend of ours in the program for over the years, Mimo Parisi, who was at InSpark, and Mimo left, of course, but every time he would come on the air, man, and here's a guy from Italy who was an American citizen, but every time he would come on the air, the guy was just about as positive. He loved the state. He just had begged us stop talking negative about the state. He had the audacity to come on the air with me and said, no, they're wrong. We are growing. We're not failing. And it is a great place to live. It's a great place where you can raise a family. And as a matter of fact, we do offer a lot of good jobs for college students as far as the brain drain is concerned. And I think somebody owes him an apology simply because when the new census correction came in, Mimo Perez was right. And he hasn't lost that. But I feel the same thing when we get through the negativity on Medicaid expansion. But let me just ask you, if, and this fiscal year ends at the end of this month, if July 1st we would expand in the 2022 legislative session, decided to go in and expand it, give me what it would look like, the numbers.
As far as benefits?
As far as what it would look like under the expansion, all the numbers, the number of people, how long it would last, how much it would cost us or not cost us, etc.
Yeah. Well, it's a good discussion. I mean, you got to look at a lot of different things there. Still under the Biden administration's plan, you would pick up additional money somewhere in the neighborhood of $700 to $800 million over the first 2 years, in addition to the benefits that would be earned on just implementing the program through tax benefits and things like that. So it's roughly $1 billion plus those 2 front years of incentive for the coming into the state. Now, if you start looking at how many, different people have used different numbers. It's going to be somewhere between 150 and 200,000 people that are not covered now that are receiving health care benefits across the state of Mississippi. And if you look at that, Paul, and even look, I was looking at some of the mixes, the payer mixes on our public hospitals. And most of our public hospitals, and even across that, and most over average across the state of Mississippi, 60 to 65% of their payer mix, in other words, the care they're providing, is going to Medicare and Medicaid patients, which barely covers cost or does not cover cost of rendering that care. Mm-hmm. So then you got, in many cases, anywhere from 18 to 14% then comes into play that is commercial payers, whether that's whoever, I won't name any names, but then you have to try to make it work on those numbers. So then you start seeing healthcare systems having issues with payers, similar to what's going on now with the university and Blue Cross, having to negotiate how do we make this work. But you can't run a business if you're expensing more than you have coming in. And that's the situation that people fail to look at when we talk about Medicaid expansion. That not only does it provide health care and create a healthier Mississippi, a stronger workforce, but it creates a stronger, healthier health system because you're able to eliminate some of that uncompensated care costs.
Let me squeeze in one thing here, though.
Sure.
I'm not an accountant, but I think a lot of people that I talk to would say, wait a minute, we do have some problems, and you are absolutely right. There are a lot of problems. But the problems may not be exacerbated by the lack of patience there and the indigents who come through, more so than all of the accounting, the insurance, how things are going, all of the minutia that is wrong in the healthcare system today. Before we even talk about dumping another $200,000 on taxpayers, we got a lot of other stuff to clean up, because if you just clean that up, how you're receiving your payments, the simplicity of that, all of the other things, it's hard to disagree with that, isn't it?
Well, no, you still got a lot of cost out there that's not getting funded, regardless of what happens. Hospitals would love to make the billing process, the collections process, all much simpler, and it has become so regulated from a federal standpoint. To the complicated issues that have been put in place by payers, so it makes it more difficult to get paid. It's not. Hospitals want to be able to submit a bill of reasonable charges and get paid.
Yeah.
And that's not the case. We've had to go a whole different route on that. Not to mention now, a lot of the capital firms. We've got a lot of capital investment firms now that are continuing to buy, whether it be specialty physician practices or ambulatory surgery centers that compete directly with the hospitals, which take all of your profit margin out of the hospitals. So then all you're left with is government payers that don't even pay you cost.
How many public hospitals do we have in the state now?
Oh, Paul, I should be able to tell you that number off the bat, but I can't. I'd be guessing.
Ballpark?
It's about half. I'm going to say about roughly 40, 35 to 40
in the state. Really?
Yeah. So you should look at a lot of small hospitals too now.
Yeah. On the public hospitals have been there for a long time.
Correct.
Why is it that the private hospitals why are they more profitable, or are they more profitable than public?
Everyone now is struggling. And if you look, I don't know if you had a chance to see the RAND report that came out a couple of weeks ago that shows Mississippi at the bottom of the cost ladder when it comes to providing health care. We were the lowest in public hospitals, which is going to probably indicate where we are in some of our public situations. Our not-for-profits were like the sixth lowest in the country, and even our for-profit hospitals were down like 7 or 8, lowest in the country. So the hospitals in the state of Mississippi have done an extremely good job keeping costs down, but that also means we're getting paid a lot less, and we're having difficulty recouping enough to cover the cost and be able to continue to invest in the operations.
The juxtaposition in there, especially for people in the capital city area, when you're driving around and you see things, and I'm not sure how this plays out on the rest of the state, but boy, you drive around, you see that hospitals are expanding, putting different services here, buying this, putting that there, and I mean different facilities to expand their services and what they're offering, and that translates to me as just a general public saying that there's got to be some profit in there somewhere. They got to be making money before they expand. So how do you figure those two things together?
Like any other business, Paul, you've got to try to see what works and what doesn't. Most of
you don't take
healthcare,
a risk unless you got a pretty good chance of somebody to back it up.
Well, sometimes you have to take the risk to be able to make it work. When all of your business is moving outside of your hospital, when we've moved into a world of outpatient care, then you have to completely retool. And, of course, that's another issue. That's another strain that's being put on hospitals and health systems to retool the machine that has always been in place to take care of patients. And its efficiency, it's a different delivery of care, the high-tech side of it, it's all changing. And hospitals, if they're going to stay in business, have to make those changes.
What's the magic ingredient? And again, Tim Moore is my guest, President and CEO of Mississippi Hospital Association. Tim, what's the magic ingredient that our buddies going into the marijuana farm with the governor and what's their? Well, he's got 3 now under his purview. So what's his magic formula that he's using that other people are not? He wouldn't be buying them.
It's I don't know that there is a magic formula. It's just trying to approach it, and I know he's worked real hard to try to get access to care in those areas.
Yeah.
And trying to look at different models where he can make it work. It's a challenge. I hope he can.
Apparently he's found something.
I hope he can. It's going to be a challenge. It's
maybe time to set up a little powwow and figure this thing out.
I talk to Quentin quite frequently.
What about Mike Chaney? You ever talk to him about some of this stuff?
I do. Mike and I had an opportunity to present not long ago at the Delta Council together, right before they gave the resolution supporting expansion. So we're on the same page. He is.
Where does the Blue Cross thing stand now?
I know that, and about all I can say about it is that I know they're in arbitration, and I have not heard where they are from that.
Would you give us the last word on Sentine when we come back? and what's going to happen? I'll give you. Hang on. I'll give you. Sure, there's a little a note inside that yellow jacket there. You can reach it out and we'll start talking. I'll give you final thoughts on that. We'll talk about Sentine when we come back in a moment. With Tim Moore, President and CEO. March on, my friends. Let's end this one here with Tim Moore and just a couple. I was going to ask you about Sentine, and I'll ask you about that one. Because you guys did launch, and I wanted to give you a chance to just touch on this one, should you want to, on something called care continuity. And is that for the general public or just for the hospital?
Now, care continuity is a data program that we're using with HIE.
Is that what it is? Okay.
Now, yes. Yeah.
But
No,
I mean, the patients don't figure into that one?
Say that again?
The patients
the patients
figure into that as far as the
they
communication.
would, not as far as communication goes. Not at this point. Right. It is strictly
not
a
replacement.
checking
Billing and everything else. All right.
Yeah, no, it's a replacement for the state health information exchange.
I got you. All right, Sentine. Is that going to rear its head again in the 2023? Is it over? Have they signed the contract to resume the relationship with the state? Where does that stand?
Yeah, well, and Paul, I got to be real careful with that because we do have a bid in the RFQ for a Medicaid managed care plan, which is TrueCare. Now that I'm not, it should come out. We should be hearing something at the end of July, August, somewhere along that line as to where the bids stand. But that's really about all I can say because we're still in a blackout period.
When does the contract expire for Sentine?
The end of next year, June, the state year. I think it goes into the state June. June 1. Mm-hmm.
Are you privy to how many people are vying for this? As far as would you know that?
Yeah, there's 5. The 3 incumbents, 3 incumbents, and 2 that are challengers.
Who makes that decision?
That'll be Medicaid. It's set up. They've got a group that does an evaluation, and I think they're also using an outside consultant to assist in this one as well.
Like a search committee type thing.
Similar.
All right.
Medicaid would need to give you more details on that, though.
I got you. Final thoughts or anything else that you want to use the extra minute here?
Sure. If you don't mind, the main thing I think we need to get across to folks is that hospitals across the state of Mississippi have a revenue problem. That's the big thing. They've done a great job battling cost, although they have experienced a lot of increased costs due to the pandemic. Labor costs up 19%. Drug cost on a per-patient basis up 37% from pre-pandemic numbers. And then, anything else, supplies, just like you go to the big box stores and buy something, all your costs are up. Supply costs up 14 to 16% across the board. So when we talk about Medicaid expansion, we're talking about increasing revenue to hospitals to offset the costs that they're already incurring. I know there's a lot of people that say, well, look, why would you want to expand another federal program if it's not paying costs now? Well, because those patients that are covered under that program you're not being paid anything for them now. So it changes that model, and healthcare is a complicated process, as we've talked about all along.
We make it more complicated than it already is.
We do. I completely agree with that.
Will there be smoking rooms in the hospitals for marijuana?
No, sir. That would violate all of our requirements as far as Joint Commission DNV goes. We could not do that.
Will edibles be allowed?
It's going to be a challenge and how that's going to work. Because there's some restrictions on what class drugs can be prescribed in a hospital and what can be administered, and those do not fall on the schedule.
That's going to be kind of. Then, would you be going against state law? Should you, or are you in between both laws? Are you in a rock and a hard place?
We're going to be between a rock and a hard place. I think we spend a lot of time there, Paul. We should be getting good at that.
I was going to say I'm not sure what your accounting number is under legal fees, but you better have. I hope they're healthy also. But seriously, and I know we will laugh about this, but there's so many people in your position. Not only in healthcare, just in every other business, I have no idea how this is going to shake out.
Absolutely.
And part of the problem is the federal governments and their differences with the states now. So if they decide not to overlook something, it's going to be a train wreck.
Absolutely. And we are very concerned about that. A lot of discussions going on as to how we approach it and how we handle it.
Well, I understand this, but we're right around the corner. I mean, we're months away from maybe the cash register ringing at a store.
Well, it's just going to be hospitals are going to be very, very limited on what they're going to be able to allow to have happen in the hospital.
That's just one part of it. The other part of it is as far as the employee bases and staff.
Absolutely. How do you control and monitor that?
Man, you better keep that yellow jacket on.
Paul, I appreciate
you're going to need to sting, man. So keep that yellow jacket on.
I've got Kevlar on under.
You're going to need it. President, CEO, Mississippi Hospital Association. Always a pleasure, sir. Thank you for taking time to come in.